Hey, how are you doing? Yeah. How are you feeling about today? Feeling okay? Good. And just to make sure, you took your entire prescription of antivirals, correct? Any adverse reaction to that? No? Good. Okay. And do you have someone here to drive you home today? Okay. Good. They're in the waiting room. Okay. Can I just get a quick cell number for them? Okay, perfect. Okay, so a bit about today. What we're going to do is first I just need to re-examine your face just to make sure everything is in the right condition for us to go forward with the laser ablation. And then for the laser ablation, what's going to happen is I'll have you lie back. We're going to cleanse your face really well, okay? Make sure that everything is nice and clean and sanitary, partially why I'm wearing a scrub cap. And then we'll begin with the laser. It's going to be using a very strong wavelength to go into the skin and remove some of the dead surface skin and scarring. Okay. It is going to leave you feeling a bit raw, so afterwards it's very important that you avoid sunlight for a few days, as well as avoid any kind of scratching or picking at the skin, okay? And we will be giving you another prescription of antivirals just to make sure everything stays nice and calm. Okay. Do you have any questions before we get started? Okay. Just let me know if anything comes up, okay? So just move your chart out of the way here. I'm going to put on some gloves. We will make sure that everything is nice and numb. I will be applying a numbing ointment to your face before we begin. And if you need a little more, we can inject some local anesthetic. Most people think that the cream, though, the ointment, is enough, but it's up to you, and we'll check it before we begin, okay? If you don't mind, I just want to take a quick exam of your skin, okay? Just to make sure that everything is in a condition that we're able to go forth, that's not going to lead to any scarring. So we need to just make sure that the skin is nice and hydrated. Okay, so you ready? Okay, so, sorry, a little close here. Make sure we have good elasticity. Good circulation to the skin. And it is pinking right back up after I press skin. Not seeing anything. Neck looks good too. No sign of lymphadenopathy, so that's good. Okay, good. So if you're ready, I'm gonna go ahead and lie you back on the table, okay? And we'll start cleansing your face. Okay, good. Okay. Are you okay lying down like this? Okay. Let me know if you need a pillow or anything like that, okay? Okay. So I'm going to begin with just cleansing your skin, okay? So okay. I'm going to place a hairnet over your hair just to keep it out of your face so everything stays nice and clean. Good. Okay, I'm just going to be placing this numbing ointment over your skin. We're going to give that a few minutes to kick in. Okay. And while that's doing that, I'm just going to change my gloves into sterile gloves, okay? Okay. Okay, so we'll be placing neutralize but protect you from any germs that I might have to spread. But before we begin, is there anything I can answer for you or anything you need? Okay. Well, let's test to make sure that you're numb, okay? So, can you feel that? How about there? Was that okay? Forehead? Okay, let's check your chin. Do you feel that? No? Okay, good. So we're going to begin, okay? So, might feel a little bit of warmth, but that's all you should feel with the numbing ointment, okay? It makes a light, sort of high-pitched hum. Great. did great. So now I'm going to put an antibiotic ointment, okay? Just on your skin. It's really gentle. Shouldn't sting at all, okay? Eyewear here. Since I don't need it anymore. So very gently, just going to dab. I have some facial masks we're going to put on your face for protection. Do you want... Let's see what we got. We have... a unicorn. We have panda, or we have a cheetah. Which one do you like the most? Unicorn? Okay. I'm going to place this over your face here, okay? hold some moisture in as well to help that ointment absorb into your skin. I'm just going to use this ice roller. It's very cold and it's going to help lessen some of the inflammation, okay? Okay. Move this to the side here. Yeah, it feels good, huh? Okay, if you're ready, we can go ahead and sit you back up, okay? Okay. You feeling okay sitting up? Good. So, just let my hands air out for just a moment. So, over the next couple of weeks, your skin's going to feel quite a bit raw, okay? So, like I said, it's important to avoid any kind of scratching or picking. When it starts to itch, that's a sign of healing, so we don't want to impede the healing process. And also, we just removed facial scarring, so we don't want to add any new scars. Like I said, skin is going to be raw. You also might experience some drainage from the skin, and that's normal. It's also part of the healing process. Perfectly okay to put ice on the skin. Okay. And I'm also going to call in for you a few prescription medication, a pain medication, as well as some more antivirals. So that's going to help you heal, stay infection free, and also more comfortable. Okay. So then before you go, let's move that out of the way. Just want to take a quick look. Okay. I'm not really going to touch, but I put gloves on just because my hands are going to get close. Alright? I just want to make sure now that your sitting up in different light, that everything looks okay. Just going to peel down the mask a little. Okay. Everything looks good. Looks like we hit all of the areas that were areas of concern. Okay, so let me write a quick prescription. Also, along with avoiding sun exposure, you also, for the next 2 or 3 days, want to avoid any kind of strenuous activity. This was a lot on your body, so we just really want you to focus on healing, okay? Okay. So, remove your prescription of Valtrex. Let's do 14 days, so quantity 28. We'll also do a pain medication. Okay, so this medication you definitely want to take with food, otherwise it can make you feel a little bit nauseated. And I'm putting in the prescription instructions to use it as needed. However, for the first 2 days, I would recommend taking it twice a day, just to make sure that you're not uncomfortable, okay? The first couple of days are generally the most uncomfortable in terms of pain. And then most patients report that after that it turns into more of an itching sensation, and that's when it gets a little more difficult to resist scratching. Really important to try and resist though, okay? So, some people have stated they find relief with some ice, or like we used here today, an ice roller. If you put a face mask over it, and then roll it on your skin, it's going to give you some protection. Once the skin starts healing more though, and it's less raw, you can use a towel, or even just try using it directly on the skin. Just don't make it as cold, so maybe perhaps just keep it in the fridge, okay? We don't want any kind of cold burns on the face. So, okay. Got your prescription. So, everything is in order. I'll let you sit in here for a few more minutes just to recover a little bit before getting up and walking into the waiting room. And then on your way out, I really want you to make an appointment to come back in 2 to 4 weeks. At that point, the skin should be mostly healed, okay? So, I just want to re-examine and make sure that there's no signs of any kind of infectious processes going on in the face, okay? And that you're healing, okay? Alright? Okay. Then my office will also give you a call, probably tomorrow, just to check in and see how you're doing. Okay. You take care. If you have any questions or concerns, give me a call, alright? Okay. See ya.